So Hai is 40. This is quite an achievement. I mean, NGOs tend to come and go, but we've stayed the course. It's been through thick and thin. But we're not alone. Buko Pharma Campaign, they celebrated 40th anniversary a couple of weeks ago. Hai Asia Pacific will celebrate in next week during the World Health Assembly. VAMOS celebrated last year. And IBFAN, although a couple of years older than Hai, will celebrate the 40th anniversary of the International Code of Marketing of Breast Milk Substitutes tomorrow. For those of us who have reached 40, and I know some of us in the room can't remember that far back, but others have yet their 40th to come, you know it's a time for reflection. Where have we been? Where are we? Where are we going? And have we got a map? So that's what we wanted to do today, reflect on 40 years of campaigning and comment, of advocacy and activism, and look towards where we are going. We will, of course, be mindful of access to medicines. This is Hai after all, but more than that, we want to open up a discussion that I think many of us working in global health are having in private, maybe around the pre-pandemic water cooler or over coffee, about the state of the world in which we operate, the political context in which we work. What are we doing as part of this massive health and development industry? I don't think we'll cover it all today, but it'll be a very good start. So why do we want to look at these things? I think it's not only because it has an immediate impact on how we work, on our daily work, but because it's in Hai's DNA. The story goes that Hai was born at the WHA in 1981. And in the second half of today's conference, we'll hear from some of those founders and members of the movement. But can you imagine, in 1981, Microsoft had been founded for just 5 years before that pivotal WHA event. Ronald Reagan had become president of the United States just 4 months before that. And Reaganomics had yet to be used as a term. And the full force, I think, of the neoliberal turn had arguably yet to be felt. It wasn't all bad. It was what some might consider to be the golden age of the WHO, when it looked like the UN might live up to its promise. Yes. In 1981, smallpox was delisted as an infectious disease. Halfdan Mahler was the DG and had been talking up essential medicines concept for 4 years. And although the seminal conference in 1985 of experts in Nairobi had yet to take place, there was a whiff of rational use in the air. There was then at least some reason to feel optimistic. Could health for all be achieved by the turn of the millennium? It's a rhetorical question. But then the Hai activists at WHO were digging deeper than support for these headline-grabbing global initiatives. Their motivation in establishing the Access to Medicines Network was the expression of a political ideal. It was rights-based, it was ethics-based, and they were angry about the exploitation of sick and vulnerable people by the pharmaceutical industry, the imbalance between the interests of public health, no matter where it was, and the interests of capital, the profit-driven health agenda. Access to medicines was their entry point, just as now, but the analysis was political. My first contact with Hai was in the late 90s, or could have been the early noughties, long before I joined the Hai team as a fresh-faced postgraduate still in shorts, almost, at a Buko event in Bielefeld. That's the second shout out for Buko. Or it may have been in Cork a bit later, but Charles Medawar, who was always the political philosopher on the team, gave a moving speech on Rudolf Virchow's statement that medicine is a social science and politics nothing but medicine at a larger scale. I think it summarizes public health's biggest idea. Human health and disease are the embodiment of the successes and failures of society. And the only way to improve health and reduce disease is by changing society through political action. Virchow was a pathologist and was linking his own work to what we might now call social determinants of health, sadly now consigned to the scrap heap of mainstreaming, also known as afterthought, in many programs, and is absent from any real One Health debate. But that inequality, and by that I mean all forms of inequality, poverty, gender, employment, race, nutrition, education, the list goes on, will lead to worse health outcomes, and not just for those oppressed by inequality, but as Wilkinson has argued, as inequality is eradicated, so health outcomes improve for us all. An equal society is a healthier society. But it's the idea that politics is nothing but medicine that is so relevant today, because health is politics. Global health is dominated by politics, whether it be member states protecting their industrialists at the World Health Assembly or using assessed funding contributions to leverage WHO. The global health agenda set by philanthrocapitalists, national vaccine hoarding, NGO donor priority setting, the capture of civil society by the private sector. Civil society space, which is shrinking at an alarming rate, and especially now as we go into the WHO, the stifling of any alternative civil society voice is incredible. The establishment of the WHO Foundation even is a massively political act initiated by globalizing bureaucrats, as if there is no alternative in the pursuit of UN finance. High does make a difference in real life partnerships on the ground and in regional and global fora. We've worked with and continue to work with amazing people at all levels, including at the WHO. But when we buy into the development and health industry in all its glory, driven by the interests of capital, we can so easily lose sight of the fundamental ethical principles and political ideologies in which High is grounded. And we can't afford to do that. We must not do that. And we need to keep talking about it. In 1981, the activists in Geneva were passionate, just as now. We remain passionate and angry and often difficult. High has never been afraid to ask the difficult questions, not only of others, but of ourselves. And we're doing that today. Passionate, difficult, and angry. Talking of which, let me introduce our panel. Nikola Dentico is an activist, journalist, and researcher with long-standing experience in international cooperation and global health. She served as General Director of MSF Italy and helped develop the MSF Access to Medicines campaign. As Policy Director at DNDi, and then as consultant for the WHO, she devoted time to the intersection between public health, innovation, and intellectual property, trying to promote needs-driven R&D. Nicoletta coordinated the Democratizing Global Health Coalition for the reform of the WHO and currently leads the Health Justice Program at the Society for International Development. Rohit Malpani is a public health consultant and advocate based in Paris. He represents NGOs on the board of UNITAID. Previously, he was Director of Policy and Analysis at the MSF Access Campaign, a special advisor to Oxfam, and a human rights advisor to the World Health Organization. Rohit is a lawyer by training, having received a doctorate in jurisprudence at the New York University School of Law and worked as a lawyer in Palo Alto, California. Our third speaker will be Anuj Kapil, who is an academic activist and an interdisciplinary social scientist trained in sociology and public health. She's a professor of global health policy and equity and director of global engagement and partnerships in the School of Health and Social Care at the University of Essex. She is a long-standing member of the People's Health Movement, a former chair of the Scottish chapter, and a gender equity and rights advisor for the WHO's HRP Sexual Reproductive Health Programme. Our final speaker will be Fatima Hassan, a South African human rights lawyer and social justice activist. She's the founder and head of the newly established Health Justice Initiative in South Africa and is the former executive director of the Open Society Foundation for South Africa. She has dedicated her professional life to defending and promoting human rights in South Africa, especially in the field of HIV and AIDS, where she worked for the AIDS Law Project and also acted for the Treatment Action Group in many of its legal cases. Our guest speakers will be spotlighted when they speak, and there will be room for clarifications at the end of each speaker's intervention. If there are any points that you'd like clarified, please put them in the chat box. You may unmute yourself for clapping at the end of the speaker's interventions, of course. And at the end of all 4 guest speakers' discussion, there'll be room for questions, which we'll invite you to put in the chat function. So with that, my little piece is over, and Nicoletta, the floor is yours.
Thank you, Tim, and thank you for this invitation. I feel deeply honored to be here, and this is not a formality. I really mean it, and I even more mean it when I see some of the names and the faces like Kirsten and others that I haven't seen for a long time. So I'm really thrilled to be in this good company. And I also feel honored because this is an opportunity to be difficult, to ask the difficult questions, and also to be in the company, in the community of people that has never given up, thinking about a better future, or cherishing the utopia, which is the not yet in this world that we want to see for the future. So I really feel a great privilege of this opportunity that you're giving me. Thank you very much for this, and happy birthday to Hai. Of course, COVID has magnified a lot of distortions or systemic distortions. We see it in all areas. I don't have time to go into details. And everybody is talking now, one of the mantra that we hear from policymakers is building back better, which tells you how, the mental projection and the political projection that these men usually have. They don't think about the future. And I really want to start a challenge in this, that as civil society, we need to build forward better and not back. And that is where COVID-19, I think, speaks to us in a very cogent manner, in a very strong manner as well. Because you mentioned, Tim, a lot of the anniversaries. I want to mention a couple. Last year, COVID-19 arrived in 2020. 2020 was 75 years of the entry into force of the United Nations, and it was 25 years of the entry into force of the World Health Trade Organization, of the WTO, the World Trade Organization, okay? So the structure, the one government that came out of that utopia after the war, the human rights utopia, in tension with the quintessential multilateral entity of globalization, of liberalization, of deregulation, the WTO. So I want to see this tension that should resonate to us today still, because we are in 2021 and Hai is organizing this meeting in a very important and I think very cogent time. 20 years ago, civil society organizations from practically all over the world were meeting in Geneva for the G8 to basically make the point that they started making in Seattle 2 years earlier, that another world is possible, and it was time for a globalization of human rights. And of course, as you can imagine, 20 years ago, they managed to stop this very strong breath that was coming from societies at large. And it was a breath for justice. It was a major request for justice. It was a transformative breath, which had to be stopped because the New York Times at that time called us the third biggest power in the world. Okay, civil society. We were making sense. We were recognizing our competence. We were denouncing the injustices, but also providing a lot of recipes and a lot of prescriptions for a better world. I think we have to bear this in mind, that really Geneva 2001 was the time of a kind of a revolution which had been prepared by the UN reform with the Global Compact. And that is also, however, when in a way the global health doctrine started. A lot of money poured into health, a lot of new actors coming on board, health and global health becoming a top issue on the agenda. So lots of things are happening, which were also positive, of course. But in fact, the power of that agenda was not in our hands anymore. The reins of that agenda were held by the big power, the strong powers, who managed to actually capacitate us, capacitate NGOs and civil society organizations to the extent that we could be tamed. And that's, I think, in many ways how depoliticization of health started. The doctrine of global health was health by diseases, basically. It was a technical solutionism and basically a biomedical approach. It was a humanitarian approach. So the emergency, one individual at a time type of saving a life counts, which of course we know it's right, but it's not enough. And also a doctrine that broadly introduced the private sector into the agenda of global health. So what Halfdan Mahler and all the period that you mentioned, which was political, ethical, it was angry, rights-based, managed to divert, came on board at the beginning of the new millennium with all these very carefully crafted agendas of the Millennium Development Goals and now the Sustainable Development Goals, where the multi-stakeholderism was tested first and now confirmed and enshrined with the time that we have. So I think we have to ask ourselves the difficult question, but where are we now after 20 years of this, predominance of the global health agenda? Are we any better? Certainly, if we have had successes, and I mean, you know my stories. I belong to this tribe. I belong to this community. So the questions I'm raising, I'm not raising them too high. I'm raising it to myself. But I think it's a question that we have to ask ourselves. Where are we now after 20 years of depoliticizing health and largely contributing to the deinstitutionalization of those entities that were in power of the health agenda when it comes to health? That is the WHO, of course, and not only the WHO, also other UN bodies. I think that health is discussed at the FAO also, it is discussed at ILOs, it is discussed at the Human Rights Council. It's not just a WHO thing, health. However, the transformation that the private sector, through the mediation of the philanthrocapitalists, have written a book on philanthrocapitalism, where my main theory is that the philanthrocapitalists were the brokers of this revolution, of this counter-revolution, that was opposing the idea of a globalization of human rights. So where are we now? COVID brings new categories for health. COVID tells us that we can no longer go disease by disease, and even at times divided within the same disease with a more, preventive approach or curative approach. We have to go beyond this. I think it brings the crisis of health with the crisis of the climate change. It brings the crisis of inequality, and we have to look at health with its all the interconnections with finance, with food, with the environment, with the paradigm of economics, basically the economics situation. I also think that the COVID has brought to us the category of how discriminatory this health agenda, global health agenda was. We have talked a lot, and we have done it. I mean, with MSF, I've done it so many times, of speaking for the voiceless. This is a totally stupid sentence, because honestly, the voiceless, everybody has a voice. Everyone has a voice. It's only the question of creating the space for that voice to be heard. And I'm not so sure that NGOs have been really the best ones to ensure that those voices were heard. No, it was us acting as mediators between a status system and the needs in order to kind of patch up some of the recipes that we thought were needed. I have 1 minute left, so I will go for the most kind of, in a way, positive side. So those are some of the harder questions that we need to ask ourselves. And by the way, it's not many communities where you can raise these questions, and that is a privilege of being here with people that have the seniority also of understanding what I'm talking about, and having, you know, an ideological, maybe an ideal background that wants to continue posing those questions. The UN is no longer the place that keeps up its promises. At the moment is an attack. It's under attack. It's a defenseless venues, and it is hard to defend it. Apart from some of the people that are there and with whom we work very well. But we really need to reframe completely, I think, the health agenda. And of course, high works for medicines. And as we were saying the other day for the preparatory meeting, we know that the problems that we have today cannot be resolved with a biomedical approach. And it is not medicines that will bring the solutions to the health problems. However, I think it is really important if a medicines-focused organization reconsiders its medicine focus, which is a very relevant focus, to a more systemic background, towards a more systemic background and a more systemic challenge that we all have. So I think that we have to frame the conversations and dare get out of this global health agenda. You really take the distance from global health and start pursuing a program of health justice, because this is what you, Tim, were mentioning earlier on, talking about ethics, human rights, being political, and being angry. These are still adjectives that are still very valid, and I would say even more valid today than in the 80s, because we are under the attack of a very aggressive and a very determined and a very powerful private sector interest-driven entity that is completely shaping with an accelerated pace that we cannot even control, we cannot even keep up, an agenda that is a counter-revolution. So it will take time and it will take generations, I think, to undo the damage of the last 20 years. I will not see, I know, I will not see the future, the better future that I want to see today. However, as a long path it is, and as a steep a walk this is, I think we need to pursue this path, because we need to go back to the ideal and the vision of 1948, when the World Health Organization was created, and the right to health created before the Declaration of the Human Rights, that it is only through health that you can start exploring, experimenting, and building a global human rights agenda where people and the person is at the center. And that is what really we have to fight and struggle to recuperate. It will be hard, as I said, but history doesn't stop here. It's not a destiny to be in this conundrum of today. It is not our last word. And the breath has been taken. COVID comes to take our breath away and to show how the world was breathless even before. Now we need to restore and reconstruct a possible breath. Thank you very much.
Thank you, Nicoletta. I haven't seen any clarifications in the chat. Do please use the chat for clarifications and questions later. You were super clear, and you've already set us on a new path to discuss as we move forward. Thank you very much, Nicoletta. We'll come back to you when we have the full panel open. Rohit, the floor is yours.
Great, thank you so much. And like Nicoletta, I'm really honored to speak here today. So first, just congratulations to HI for everything that you've done, strengthening the voice of advocates and communities on your efforts to ensure independent policymaking, and especially around ensuring access to medicines. So I wanted to start by talking about myths. As some of you have probably read in the book Sapiens, societies are based on the idea of fictions or myths, right, which allow groups of people to cooperate in large numbers. And I also think myths are something that we use in other contexts, whether influencing how countries relate to each other, and I think for our discussion today, for how companies justify their policies and practices. And the drug industry has really used two myths over the last 40 years. From around 1980, drug companies sold a myth that governments were free riding off of their efforts, and that only patent monopolies could ensure that countries would pay for their fair share. And this myth was really successful, right, in justifying the global expansion of intellectual property through the TRIPS agreements and all of the additional intellectual property rules that have emerged over the last 20 years. But the second myth is the one I really want to talk about, which is one that I think emerged right around 2000 as drug companies were facing a lot of criticism for their practices, and as intellectual property rules were also coming under criticism, both for high drug prices and for a lack of research and development in neglected diseases. And so drug companies started to sell a myth that voluntary approaches could solve these interrelated problems. And even as the first myth was not disappearing, the second myth, or something that drug companies would do the right thing, has taken hold and really has put us in the situation we're in today. And the problem with us as civil society is we have not pushed back against this second myth. And we've arguably made it easier for it to take hold and to allow drug companies to legitimize voluntary approaches to systematic problems. I think it has also allowed drug companies to be accepted as legitimate stakeholders in global health, as we're seeing with COVID-19. Now, you could argue that, however imperfect it was, the work that many of you did around the Doha Declaration and the pushback against the pharmaceutical industry 20 years ago, it had real momentum to it towards accountability. The idea that there were red lines that governments and companies could not cross, and that really overcoming HIV and ensuring access to medicines had to really be developed by governments and by those living with or at high risk of HIV. But the drug industry has really chipped away at this, right? The sense of never again slowly weakened. And I think we all forgot what led to these initial gains. And I think we as civil society have collectively moved towards an approach to access to medicines too grounded in voluntarism. And the idea that the drug industry could somehow be co-opted to do the right thing. And I think the language of win-win approaches was not just espoused by industry, but by all of us. For example, in voluntary licensing agreements signed by companies, and often in the partnerships to develop medicines on behalf of neglected patients. Now, I want to be clear, I understand the reasons for this approach and the importance of achieving tangible progress when people's lives are at stake. I was, and I'm still very much a part of this. It's what I've dedicated my career to. But I have to ask myself, did we sacrifice long-term goals for these near-term efforts? Were we always clear-eyed that there was going to be a downside to win-win approaches to access to medicines? Have we become too focused on solutionism to issues and challenges that do not require solutions, but require political tension and to some extent the messy back and forth of competing interests? The win-win approach worked over the last decade because there was no real pain or trade-off for the winners, for drug companies and for wealthy governments. Drug companies got their profits and repaired their reputations. Wealthy countries could afford to support the response and improve their standing. And low and middle income countries got access to low-cost medicines, at least on terms set by drug companies. But win-win solutions only work when those with power do not have their power or profits challenged, and when the disease itself only affects people living elsewhere. If the more powerful side has to make a sacrifice or may actually lose something, the win-win solution becomes a win-lose free-for-all. And as we have seen today, we know the outcome. And indeed, we have to ask ourselves, what did a decade of trying to move industry in the right direction get us? Companies that the new ones and the old ones have ripped up the rule book we thought we were playing by. We thought there was a common set of assumptions and norms in how we approach access to medicines, but there isn't. I do think, of course, a lot of progress has been made in the last year, and I want to be positive about that. I think we've stopped worrying about being reasonable. We are less focused on representation and maybe more focused on criticism and on failures. And I think we've started to make real tough demands for systematic solutions, such as for decentralized manufacturing and to introduce a waiver of the TRIPS agreement. But it should give us pause, for example, that yesterday the G20 came back to exactly where they should not, which is to adopt a voluntary approach to bringing forward new vaccines and other technologies in the coming period. And so I think, taking a step back, the wider issue is, has the boundary between what we as civil society do and what governments and institutions do become too blurred. We have jumped through all of the hoops they've put out for us. We make all the right technical arguments, we compile all the evidence, and we have even designed an ideal system for making pharmaceuticals affordable and available. Many of us have sought to work through these institutions and governments. We've joined them, and it's always in the hope that we can make the system better. But again, maybe as Nikola is saying, we have to be less reasonable. We have to be comfortable with sticking out like a sore thumb. And we need to be clear where our participation ends and where accountability for governments and companies begin. And I wanted to end by, sort of talking about something looking ahead, which is really about the challenges lying ahead for us that I think are even more transformative and more dangerous once the pandemic recedes from views. In the last few years, and this is an issue that I've really taken to a lot, large technology companies and really a lot of other types of tech firms are slowly emerging as critical participants in our healthcare systems, for now, especially in the United States and Europe, but increasingly in low and middle income countries. These companies are not just seeking to work in one part of the healthcare system, but all of it, including the development of new drugs and diagnostics, and providing primary care and mental health services, in managing surveillance, and in gathering data to improve their predictive capacity, whether to predict who will get diseases, when people will get diseases, or really that somebody may have a disease, but it has not been diagnosed. And these are not companies that are looking to integrate into our healthcare system, but to disrupt them and to eventually fashion them in their own image, much as they've done to our media, our political systems, and really in how we relate to each other. So we are going to have to face a whole new range of concerns on the loss of autonomy, of racial bias in algorithms, of not understanding how an algorithm arrives at a decision, and the use of data and machine learning to develop more personalized products and services that are not appropriate for most people in most contexts. And so as civil society, our challenge will not just be to understand the language of digital health and artificial intelligence, but to build new linkages to civil society groups that have already been addressing the impacts of tech companies in many other domains. And again, in returning to what I started with, really to consider how we challenge these companies and systems to ensure that their choices and actions are not those that they want, but those that are required. And again, I really just want to thank Hai for inviting me and to say how much I admire all of your work, and looking forward to continue working with you. Thank you.
Thank you, Rohit. Excellent, excellent. So much to think about already with two speakers. Go on. We have a couple of things in chat. I think there are more questions than clarifications. I don't see clarifications, so we can come back to those in a little while. So without further ado, Anuj, the floor is yours.
Thank you, Tim. Can everyone hear me? Okay, great. Thank you, and a very happy birthday to Hai. I'm really privileged to be sharing this panel with people who've continued to inspire us despite the dismal situation and context we find ourselves in. A lot has been said, and I am questioning whether I need to say any more. So what I'm going to do is really move away from the work that I have been doing in the context of global health politics and governance, highlighting deficiencies in global health governance, looking at public-private partnerships and how they've impacted local health systems. And I thought, because we had all these fantastic speakers covering that very eloquently, I thought I'm going to move away from that, from the focus on architecture and on systems, to turn my gaze really to the shrinking and infiltrated and the neocolonial spaces that global health advocacy inhabits, and that the civil society is extending today. So the central premise of my talk really is that we have failed to counter these trends, and what we are seeing currently, in part because we've too long focused on the hardware, on the architecture, on the regulations, on finance mechanisms, aid flows, drugs, and vaccines. While that's important, I feel we've too long regarded this as a crisis of health systems and finance and politics, and neglected core values and the framework of thought that should guide our work and actions. I highlight some of these failures that the contemporary global health system now has to contend with. First and foremost, what also was mentioned by Nikola is the complete disconnect between those making decisions and those living the consequences of these decisions. So while coming up with the nuanced analysis of the political economy of health and identifying actions to hold the WTO and the IMF and finance institutions and states to account, we fail to connect simultaneously, locally, with communities and disenfranchised citizens, as well as local grassroots movements. And in doing so, in failing to do so, we've really created opportunities for the capture of these spaces by fascist, authoritarian, and capitalist forces, resulting in the state of play that we see today. With the whole discourse around vaccine couched in nationalist fervor, and increasingly divisive spaces within which we are addressing and tackling global health today. As advocates striving for equity and social justice, we've also failed to call out the processes that shape and widen this disconnect, which really requires analyzing and confronting intersecting power relations. We've been blinded to the intersecting injustices and oppressions that our society is entrenched in, including the predominance of decision-making spaces by white men from the former colonial and neo-imperial powers. And these decisions continue to be taken in extremely elite and exclusive spaces. And which really need to be tackled simultaneously, not in silos. Unfortunately, there have been these different political struggles have continued to operate in silos and not overcome the schism within which they operate in. Now, what this would require is really a self-criticism of our own institutions, our practices, and our politics. Questioning of the knowledge production, what we know and how we know it, how we use knowledge for emancipation, and the extent to which this knowledge production is supportive of local knowledge and values that speak their truth. Now, the resistance movement that we see today, even the progressive civil society, has never been more divided than today. And this was apparent in the context of the pandemic and the current pandemic crisis that we are facing. So not only this led to early responses being completely couched in biomedical and epidemiological risk models, identifying 3 risk factors for the pandemic: the elderly, age, as well as the comorbidities, without looking at how these are distributed in societies and how social political inequalities reinforce the vulnerability of certain populations to the pandemic. That led to excess deaths, excess infections among people from minority ethnic groups in deprived communities. And we failed to address these, and we continue to fail to address these. But interestingly, the initial analysis of this biomedical risks were then countered by competing claims on who's more vulnerable. So we had even within sort of the gender movements, claims being made that it's more men who are dying, but there are more women who are who have the burden of care. We also had competing claims around the people with disabilities, around those living with from ethnic minorities and minority races in countries like the UK and US. We failed to connect across these systemic failures. We failed to connect across these social and political determinants that were influencing the vulnerability and resulting in the disproportionate burden of the pandemic on certain populations. So what really we need is a transformative approach, but what sort of a transformative approach? It really demands building solidarity across these divides and fault lines to simultaneously challenge colonial, patriarchal, capitalist, and nationalist ideologies in order to flatten the power hierarchies that were so long established in the colonial era. Now, with that problem established, that we've really operated in silos, what I want to turn to very briefly in the next couple of minutes is to what I regard as domains of change that are necessary for freeing global health from the prejudices and biases that maintain and as well as reinforce inequalities and injustices at various levels. which is also is gaining momentum under the decolonizing global health agenda. In order to really develop critically conscious citizens, for firstly liberating self and then liberating the others. So before we even begin to talk about how we bring about change, I think it is important that we question ourselves of what our politics are, and to what extent have we continued to reify these divides and inequalities, or reinforce these. So a starting point for this systemic change is the need to reform thought, to interrogate the sites and interstices of power and privilege that shape our understandings, as well as our ability to define the very problems that the global health community is committed to tackling. So such reform cannot result from a mere tinkering of existing systems, of existing ways of practice and doing, even within civil society, but really requires actively challenging the Anglo-Saxon, Eurocentric framing of the problems of global health. For example, we continue today to reify the North-South divide without questioning poverty, deprivation, gender inequalities across the North-South spectrum. When highlighting problems of global health around corruption in health systems governance, we continue quoting reports from Transparency Index, which talk about how low middle income countries continue to engage in corrupt practices without paying equal attention to instances of institutionalized corruption in high income countries when we cite these reports that are headquartered in Europe and rank few Latin American or other African countries highest in the corruption metrics. For instance, I mean, a classic and the most sort of recent example has been the reports of the blatant outsourcing, privatization, and outsourcing of critical COVID services in the UK, from contract tracing, testing centers, building data repositories, how large private corporations were given these large-scale contracts without any clear rationale and without transparency of contracting in the UK. We failed to bring that aspect to attention as a significant human rights violation when reporting these in the context of COVID. Being part of an independent report on how what were the human rights implications of pandemics, I struggled to find sources which are going to talk about these human rights violations in high-income country context. They continue to talk about the violations in low and middle-income countries, not suggesting that those do not need to be brought to attention and states to account. But I think we are fighting the same problems across that North and South divide. So a transformative approach does require us to simultaneously question how these corrupt practices in LMICs are occurring at the same time as those in the global North. But also this questioning of the knowledge, how we understand global health. It also requires questioning how these corrupt practices in the global South are warranted and often facilitated by the global aid complex that serves the interests of the wealthy Western nations and initiatives. Much of my work on the Global Fund has been precisely looking at that. And also querying the sources of knowledge that are cited and legitimized due to the financial and symbolic power of the same institutions. I'll end there and I'll pick up on some of these issues in more detail in the interaction that we have following this. But want to conclude with the point that any political transformative project, first and foremost, requires a solid foundation of values that enable transformative actions and reforms. The values that we hold as non-negotiable in this endeavor are solidarity, empathy, humility, and collectivism. And on this account alone, I feel the contemporary global health society cannot be farther away from utopia. Sorry to end on that very grim note, but over to you.
Thank you. Thank you very much for that. There's a lot of wake-up calls in that for us sitting in the global North and in NGOs. Thank you. I still don't see clarifications. I think we can move straight on. If I may hand over again, the floor is yours. I think you may be muted. Hi team, do we have any volume there?
I think Fatima, maybe if you're using headphones, maybe they're not plugged in properly, or I'm not sure. No, we still can't hear you. Perhaps if you try unplugging them.
Yeah, try and plug them. Now it works.
Fatima, try, there's an arrow next to the mute button. If you click on that arrow and it says select the microphone, try picking another one of the microphones and see if that works.
Can you hear me now? Perfect. Sorry about that.
Yes.
Talking about voice for the voiceless. Okay, so I'm going to try and get through my 8 arguments in 8 minutes. And, you know, I thought I was going to be the most radical, but Anuj, thanks. I think you've given us a lot to think about this afternoon. So I want to give you some perspectives of what's happening in the global south. What we know so far is that at least 3 million people have died. And as Rohit said, we expected the pharmaceutical company CEOs, about 5 or 6 CEOs in the world who this morning we just found out have all become sudden billionaires through some amazing work through Oxfam International and the People's Vaccine Campaign. But as expected, and I think as we saw during the HIV/AIDS crisis, these billionaires have actually not done the right thing. And the reasons for that are complex, but also simple. And that's, you know, I would define it as 2 words: pandemic profiteering. So about 3 days ago, the Archbishop Emeritus, Nobel laureate, Bishop Tutu in South Africa received his vaccine, months after many young and healthy people in parts of the global north actually received their vaccine. And I think that for us, that was, you know, what we had been saying for the past year, that in this pandemic, what we thought were gains made by the global health community, which Rohit has spoken about in terms of holding the industry to account, those gains have actually been reversed and taken away, because we've been now beholden to, in our country, at least 2 CEOs, but in many parts of the world, you know, basically 4 or 5 pharmaceutical CEOs and a few presidents who come from the global north, whose own citizens believe that there should be a relaxation of intellectual property and patent protections in this pandemic. So if we thought this pandemic was going to bring about solidarity and humanity and care for lives who are people who are Black and brown in the global south, in fact, the total opposite has happened. And I think that our strategies have to take that into account, because in the next pandemic, it's going to even worsen. And I think all of our strategies around dialogue, around consultation, around pooling of technologies, around waiting for benevolence and charity are strategies that are actually not working. It has had the total opposite effect of what we actually thought was going to happen. And, you know, many of us, I was asked to speak about what happened with HIV/AIDS 20 years ago. And many of us who were part of that struggle, and there's quite a few people on this call who were part of that struggle that eventually led up to the Doha Declaration in terms of the TRIPS agreement, we thought that never again, right? We didn't think that in our lifetime, we'd be spending our energies on 2 pandemics where the behavior of the pharmaceutical industry progressively gets worse. So instead of achieving the progressive realization of the highest attainable standard of the right to health and, you know, having the necessary measures to make sure that there would be access to medicines, we've actually seen a worsening of the profit agenda. And I don't say that lightly. I don't say that as, you know, some left-wing sort of human rights activists. I mean, the profit agenda has actually worsened because we've seen the increasing commodification of medicines, of diagnostics, of testing technologies. I mean, when I use medicines, I mean it quite broadly. And so in effect, what we've had to deal with is this reality that the Doha Declaration has had very little impact. It was lip service to the global access medicines movement and to that particular agenda of trying to decommodify access to healthcare and decommodify medicines. It's hardly ever been used. It's so difficult to use. And if you do want to take advantage of the flexibilities of the TRIPS agreement, whether it's on HIV/AIDS, whether it's on COVID, there will basically be two things that will happen. Trade pressure, as we've seen in the last year in relation to the waiver, and diplomatic pressure. So the pressure that my government, South Africa, who ironically all of a sudden decided to actually be a global champion of medicine access when it didn't during the denialist years of HIV/AIDS, goes to Geneva in October of 2020 with the Indian government, who in my view is run by a fascist right-wing political party. And so there's a certain irony in who actually went with this particular waiver proposal to Geneva and now has, you know, 60 other countries co-sponsoring the proposal and has over 100 countries supporting the idea of the waiver. The reaction of trade delegations, of diplomats, and of pharmaceutical industry CEOs, but their lawyers as well, armies of lawyers, to that particular waiver proposal, I think is telling. It tells us the struggle that we have as the global health community going forward, right? So one would have thought in a global pandemic where infections were rising, where it affected everybody equally, where it had a massive impact on the global economy, on the bottom line, it had an impact on every single country's health system, on the interruption of TB, HIV, cancer services. I mean, unprecedented. One would have thought that in this pandemic, that a waiver would have been a simple measure. It would have been a simple thing that there wouldn't be that much of opposition, that you wouldn't just have to rely on voluntary licensing and measures, that there would be unprecedented global solidarity. And what we saw was actually the total opposite, which is why people like Rohit, myself, Els from last year have been warning, do not rely on benevolence and do not rely on charity because they are not enforceable. And this is, one of the key lessons of the HIV/AIDS crisis. So what we have is a situation where some of the key institutions that were set up to ensure equity in this pandemic, whether it was Gavi or COVAX or CEPI or a number of other mechanisms to try and have equitable access to the COVID-19 vaccines, they all bought into this idea of we'll bring the CEOs around the table and then they'll share technology because they're interested, in the global common good. But that is not what happened, right? CTAP didn't have a single company coming to share their technology. COVAX could only, and now that figure is even more reduced, stood up proudly, which is ironic, right? To say that we can only cover 27% of vulnerable people in low and middle income countries. That's been further reduced in the last 72 hours because of the statement that's been issued by Serum. So this idea that the drug companies would do the right thing, that the CEOs would come to the table voluntarily and negotiate in good faith has, I think, been shown to be the biggest myth, right? And has actually shown why we need to be more different in our advocacy demands and why we can never trust this industry, because it is insisting on further commodification of medicines, of diagnostic kits, of a number of things that can take us out of this pandemic. I mean, we saw it with PPE as well. We saw it with ventilators. We saw it with oxygen. It's not just limited to vaccines. And I think that's an important point that we need to make. And so here's the nub of what I want to argue, is that all of this put together basically meant that Geneva became the epicenter of power. Geneva, through the WHO and the WTO, is now tasked in the global world with making all of these decisions. This, to me, is ironic and bizarre, given where the scale of the problem is, given where the patients are, given where the burden of disease are, which is actually in the global south. So there's a certain irony that Switzerland is opposing the waiver, yet it claims to be this neutral space where it allows the WHO and the WTO to do its work. And so the irony of this pandemic for us has been, once again, like with the HIV/AIDS crisis, we have had to look to the WTO. We have had to look to Geneva to find us solutions for access to equitable access to vaccines and diagnostic kits and treatment and medicines. And I think that is one of the key things we're going to have to deal with in the next 4 years. In the next few years, we have to take the power away from Geneva. And the fact that we're having to rely on a trade body, the World Trade Organization, and its imperfect system of rules and processes and consensus building model is actually deeply unsettling and deeply problematic for people in the global south. Because if we're going to rely on the WTO for the next pandemic and the next one and the next epidemic, we will never have meaningful access in the global south. The WTO, to me, at the moment, is one of the greatest barriers to meaningful access. The fact that we still have to negotiate a waiver 8 months after, while 3 million people have died, tells me that there is a fundamental problem. And in this perverse way, which is what it was intended by Pfizer's senior management in Japan and the US and the EU, who ironically are the biggest blockers of the TRIPS waiver at the moment, right? Japan was supposed to be hosting the Olympics, but doesn't want to support, a greater sharing of technology, which could actually have a successful Olympics, but is actually blocking the waiver, is that we've now clearly seen with this pandemic, and I think there's absolutely no question, that benevolence is actually not sustainable as a solution for meaningful access, but that intellectual property, the intersection between intellectual property, trade rules, and medicine access is actually creating a greater crisis. And we have to find a way as activists to remove access to medicines from the ambit of the WTO. It can no longer be commodified. It can no longer be regarded as a car or a piece of jewelry. I mean, there's something quite perverse to live in a world where you have trade rules that govern medicine access. So my final sort of concluding remarks is that if we're going to be genuine global health activists, I think we have to call it out. We have to call out the obstacle of the WTO. We have to call out the fact that its rules are actually not designed to really be flexible or to actually help in a pandemic on an urgent basis, that its consensus-based model is actually just a lot of hype. It's not really about consensus. It's more about diplomatic pressure and about really powerful trade nations who have greater power over 100 countries that are saying we want the waiver. I mean, why can't we just go to a vote? Why do we have to wait another 8 months for a watered down negotiation, which the US government is now, trying to basically sort of shape in terms of what the final text waiver is? So I think I agree with Anuj and Rohit. It's time for systemic change and Nicoletta. And we're going to have to be really pushing the envelope. Not just in terms of more meaningful access to medicine, not just in terms of holding the pharmaceutical industry to account, but really challenging the power and the function of the WTO, which right now, the way in which this whole system is operating globally has basically undermined and distorted every single democratic institution and tradition in my own country. Basically, our constitution has been suspended for the benefit of what the pharmaceutical industry wants. We're having to resolve these issues of access, not through our own constitutional court, but in Geneva at the World Trade Organization. So something is definitely not quite right. My last point is that we have to join the WHO DG in calling the situation morally grotesque. It is morally grotesque. It is unacceptable that I have to wait until March 2022 for my vaccine, that my mom has to wait until another 2 months for her to get a vaccine, while people in the global north are getting their second dose, getting their second shot. I mean, it's really a bizarre situation that we're in. And I think that the vaccine apartheid that we're seeing now is really a sign of things to come. It's going to get worse. If there's going to be booster shots, if there's going to be new vaccines for variants, the situation is going to worsen. And what we need is all of your support, obviously, not just in relation to the waiver, but also in relation to tech transfer and sharing of the vaccine know-how. So I'm sorry for trying to rile you up, but I'm really angry at the moment Because somebody, I just showed a photo earlier to the panel, somebody like Justice Albie Sachs, who fought for democracy in South Africa, who's over 75 years old, only got his vaccine today. And only got a Pfizer vaccine because Johnson & Johnson refuses to give licenses. And so the supplies are delayed from Johnson & Johnson because of the contamination in a plant in the US. So let me stop there, Tim. Thank you.
Thank you so much. Thank you to all the panel. There's some real revolutionary ideas here. And I mean that with a capital R. I mean, moving away from global health agenda, and that the biomedical model just is not offering a silver bullet at the moment. And we're buying into a morally corrupt system. So I have a question for all of the panel. Oh, by the way, the questions in the chat are being answered in the chat as well. So we'll pick up some of those in a second. But I mean, it's in three parts. Civil society organizations can grow, but in a sense, the big organizations only grow because they're buying in to a morally corrupt system. Highs remain relatively small, but it seems to me, this is the second part, that NGOs, as they grow, become corrupted. I mean, in one of the teasers that I put out, I spoke about the All Africa Health Conference. I can't remember, but that's run by an NGO that's well known to us, and it was sponsored by the pharmaceutical industry. It was entirely sponsored by the pharmaceutical, including the IFPMA. So it seems to me that the Africa Health Conference, our hope for the future, driven by an African organization, actually is already sold out. And that's problematic. So how can we be part of the collective consciousness? How can we accelerate that? And that's a question to all the panel. I don't know if you would like to unmute and come in. Nicoletta, you're unmuted already, so.
Oh, am I? I didn't mean to. I didn't mean to. Well, I don't know how, Tim, and this is not a strategy that can come out of individual thinking. I think it requires a lot of collective thinking and moments like the one that you are offering us today. Yesterday, we tried as a Society for International Development to talk about IP monopoly capitalism, because actually this is really the hardware that we have to look at, and not get, of course, as important as the IP waiver is to get our foot in the door, but it would really be rather naive to think that we get away with the waiver and for a COVID thing only, and now even being restricted to vaccines only, and not even to all IPRs. So we really, this is the time. This is precisely the time. I very much agree with what all of you were saying, but I'm just hanging on Fatima's last words. This is the time. We have nothing to lose. I think we've lost pretty much everything. We've lost pretty much everything. And I must say that also we are talking about a constituency, the global health constituency, that because it has been divided by diseases and kind of a patient's agenda in a way, it's particularly conservative. I don't know. I have the privilege of being confronted sometimes with other constituencies, other groups like the nutrition and food or environment people, or even the finance people. They have a much more proactive approach, a militant approach, and they know that there is a conflict that we needed to cross, and that is the desert that we have to cross. Whereas we have really gone through this solution, a very pragmatic approach of dealing with the disease, dealing with the medicine, of course, bringing down the price. It's all there. I mean, we did it in good faith. It's not that we were working towards, the strong powers agenda. No, we did it all in good faith. But I think, as I said at the beginning, that COVID tells us that this isn't hardly sufficient at all. And in doing so, unwillingly or unknowingly, we have participated. I mean, Rohit said it very, very nicely. We have contributed to a new governance system and to a new system of deresponsabilization of the public function, of the state, of the government, and basically to a solutionism that is the perfect solution that they want, those powers want. So I think it's a long journey that we have to engage ourselves into, but we are in a position where we have nothing to lose. I think we should leave. I mean, that's. I mean, I can share with you some of my random thoughts that I have, even with my colleagues or others. You know, we have engaged very politely, very nicely. We have gone to all these meetings. We have worked on documents, and I did it for years myself, so I'm self-criticizing. We have done it for years to get a shall instead of a should, a comma or not a comma, a word rather than another, for documents that are mostly ignored, resolutions, okay? Soft norms that, I mean, it takes years to negotiate them, and then people put them in their drawers and they just don't consider them, okay? I'm being provocative, but I'm being self-provocative. We've wasted years in doing so, where decisions were being made elsewhere. I mean, honestly, do we think that the WHO is the place today where health decisions are being made? We are very naive if we think so. We are extremely naive if we think so. We have been constrained, and we have been accepting this constraint of doing damage control. I mean, because we are now in the multi-stakeholder arena, and we are one of the multi-stakeholder. By the way, we are denominated exactly with the same definition as our counterparts, because we are all non-state actors. Doesn't matter where we work for the public interest or we work for the private interest, and we have accepted that. I think we should not have accepted that, because language matters, words matters, okay? And we have accepted that. I think we should leave all these rooms after decades of polite engagement. You know, there is a nice movie, a famous movie, Italian, by Nanni Moretti, where the protagonist at one point asks himself, will they notice me more if I stay, if I go, or if I don't go to the party? You know, I think we should stop not going to the party anymore. We should take a distance. We should organize the streets rather than the closed rooms of the UN. We should create new alliances with people that are not strictly working on disease or medicines, but on common goods, because that's the agenda for the future. We are so badly fashioned at the moment that since the UN system struck this deal with the Davos, with the World Economic Forum, when they created this structured alliance and they signed this alliance in June 2019, not only is the WEF, the World Economic Forum, already situated in the UN agencies, this is what happens in Rome with FAO, for example, but they are now completely devising and shaping processes outside of the UN system, shaping their own NGOs, creating their own civil society institutions. That is the case of the Global Citizen, which is being prepared for the Food System Summit in New York, but which is very much promoted also for the COVAX and for all, I mean, the same actor. You know, no one knows them, basically. They are all financed by the philanthropic capitalism, by the private sector. So they are even shaping the new CSOs. My African friends, African people, African communities, when I had the privilege of spending some time with them, taught me very well that when you are South African people, mostly, when you have nothing to lose, you may, out of your, in a situation of weakness and fragility, become the strongest. And I think for me, this is the power that I feel. This is, in a way, an unpredictable power that we have.
I'm just calling a halt to that, because we're running out of time and we need to get onto our second part, Nicoletta. I just wondered, we have a question in about, let me find it, for Rohit specifically. Oh no, to Fatima, sorry. From Patrick, says, we have to move out of power from Geneva. Do you mean move it from WTO and WHO, or did you have another institution in mind elsewhere?
Thanks. No, I think I've answered that in the chat to the WHO.
Oh, you've done it. Fantastic. Okay, one more quick intervention then. And this really concerns me. It's the question of voice for the voiceless. And I must say we've been guilty of using that. We've used it for snakebite, voice for the voiceless. It was a buzz. And it's always been uncomfortable. But how do we recreate a global collective consciousness in NGOs when we have done so much to mess it up, frankly? Fatima?
Oh, sorry, go ahead.
Oh, Rohit. Yeah, Rohit. Fatima.
Please, Fatima first. I'd rather hear. Okay, I'll go super fast. It was just in thinking about it. It's an interesting moment, and it was something I meant to say before. Actually, there's a big crisis right now for funding for access to medicines, which is ironic at the moment that this is sort of in the global headlines every day, and it's sort of one of the most salient issues. At the same time, what I'm optimistic about is the breadth of organizations that have taken up this issue, that are speaking to this issue, and that are thinking about it in a way that I think is very different than a lot of us have. So you see much more of a breadth. And I think this idea that it needs to be deprofessionalized somehow, and I'm a professional in this area, so I'm sort of speaking to the importance of deprofessionalizing it. And to pick up on Nicoletta's point and also Fatima's, if you look at the environmental movement, there is a lot of people arguing over the technical parts, but a lot of its power comes from its deprofessionalization and its localization. And that's to Fatima's point, like localism, I don't know how that works necessarily in access to medicines. I think it looks very different, of course, than when you talk about it from the perspective of environmental movement. But there is a real power there, and there is a real idea then that people have agency. And I think it's our challenge to not just re-professionalize it and build the walls around what we do again, because I think this pandemic, for obviously very tragic reasons, has brought down those walls. And so I think it's on all of us to keep those walls down and to keep building this sort of wider consciousness, as you put it, Tim.
Thanks, Rohit. Fatima?
I mean, nothing more to add to what Rohit says, but I think that the important thing to remember is that as activists, we have been pushing the envelope for the last, I know I've been pushing the envelope for the last 20 years. You've been doing it for 40 years before other people were doing it. And I think my plea is to just say that we can't trust the system. And I really think the pandemic has shown we can't trust the pharmaceutical industry. So our energies and our efforts going forward has to be totally redesigned. And we really have to continue pushing the envelope, because all of the victories we've had, whether it's around access to ARVs or even around access to vaccines, the fact that people are getting vaccinated in my country today is because of civil society, because we have actually been pushing the envelope. So, I hope that I hope it hasn't come off as suggesting that nothing we do has any impact. I think what I'm saying is that we really do have the ability to create a lot of change. It's, are we aiming high enough? I mean, why don't we create this movement and momentum around the fact that the WTO has actually not helped us in the last 12 months? Let's do a people's tribunal. Let's do the reports about how the WTO and its rules has actively blocked the ability of the global south to benefit from scientific knowledge that was actually co-funded and co-developed by public funds and public money and public institutions. My country participated in 4 clinical trials and we weren't at the front of the queue. We're now participating in a 5th clinical trial and we only got access now. So I think there's just, there's a lot of room to actually revive the movement. And like Rohit said, to revive and support the access to medicines movement, because that is going to be a key challenge going forward.
Thank you.
Tim,
So we're working out how we're going to save the chat. So that will also be available at some point, I'm hoping. And now just for a quick intervention from the High team. Jaume Vidal has for over 15 years been working on medicines related issues in international organizations and think tanks, and since 2019 has been on the High team. So he's witnessed some notable developments in the intersection between human rights, health and governance, such as trade agreements, IGWIG, and the TRIPS waiver, of course, which he's driving from our end. So he's a key member of our team in Amsterdam. And during the brainstorms for this event, as the panel will know, he's been really inspired. And so I thought he was the ideal candidate to give a quick response. And with the emphasis on quick, because we need to go to the next section. But Jaume, I hope you're there. The floor is yours.
Yeah. Thank you, Tim, and thank you, the panel. I think if we ever do a recruiting drive for the Access to Medicines movement, we are going to be showing this panel on and on and on. I think it was great. It was really good. How did you really highlight the main contradictions that we are living and that in some cases we are part of? I think it's important also like to see like how high fits into these patterns and dynamics. Like we've been at WHO since the beginning of the organizations. We are being part of the grassroots movements, and we try to influence processes that sometimes are far from our immediate realities. I think it's really interesting, the issue that we've been listening to about on behalf of whom do we speak? Are we really giving voice to these groups, or are we replacing them? And I think what I really take, it's like this self-reflection that we need to do as activists and as an organization when we are turning 40. And I wanted to finish with a really very short comment on what's the next 40 years going to look like, and the need to already be engaging with the next generation of activists and advocates, and do it with respect and do it with empathy, in the sense that these people, like when Rohit was talking about this professionalization, let's never forget to be accessible to people, to really give like a hand, being a mentor. It's really important. I mean, for a movement, I mean, story, these last 40 years are as important as how we shape like the future. And at HAI, I am privileged to work at HAI, but I'm also privileged to be working with people that are going to be the next generation of the Access to Medicines movement. And I think that that's a rare honor to be like around people that have contributed and are contributing so much, and people that will contribute a lot more. Thanks.
Thank you, Jaume. Thank you, members of the panel. I hope you're going to stay with us for the next part of our event. And I'm just trying to find my notes here, because we move to the more celebratory part of the program. I mean, that was quite a ride, and I need a drink now. So even though it's quite early in the day, I hope you've got a beverage handy. Long may our voice be uncomfortable. I think that's one of the messages I'm getting from them.